اسمي إكرام عبدالقادر عبدالله محمد، سودانية الجنسية، بعيش في المملكة العربية السعودية في أبها، معلمة، المهنة معلمة. كنت أعاني من ورم في الرأس ضاغط على الغدة النخامية وضاغط على العصب البصري، كان أثر على نظري بصورة كبيرة، يعني ما كنت أرى الأشياء بوضوح. فجيت هنا إلى الهند وعملت فحوصات وكده، وتم استئصال الورم عن طريق وتم استئصال الورم كليا الحمد لله. والحين لي 11 يوم الحمد لله، الرؤية اتضحت من أول يعني بنسبة عالية الحمد لله، وصرت أرى الأشياء يعني بوضوح يعني نوعا ما.
Hi, I'm Dr. Abhilash Bansal. I'm Senior Consultant Neurosurgeon and Spine Surgeon from SPARSH Hospital, Rajarajeshwari Nagar, Bangalore. Meningiomas are benign tumors of the brain which arise from the coverings of the brain. When I say benign, they are not cancerous, but however, being present in certain locations, they can cause damages to the brain by causing pressure on the vital structures in the brain. Of all the meningiomas, Tuberculum Sellae Meningioma is one entity which is found in certain patients who present with visual disturbances in the form of progressively worsening vision. Ekram came with such type of things, and then she has had the complete visual loss in both the eyes. Tuberculum Sellae Meningioma, they comprise about 10% of all the meningiomas of the brain. Early diagnosis is the key in the treatment. For diagnostic purpose, we require to go for the visual field assessment, MRIs and CT scans. These are good tumors in a bad location because they will be causing pressure on the optic nerves, which cause the impairment of the vision, and also it causes compression and involvement of the vital blood supply to the brain. At times, these tumors, they present with seizures. Surgery can be done, and that is the only hope for recovery of the vision. We have undergone the surgeries for this patient, and then vision has significantly improved in over next 10 days time.
إن شاء الله كل يوم أنا أحسن وأفضل، والحمد لله دحين أنا أفضل كثير من الأول. Thank you.